Today we're going to do shoulder mobilization of the GH joint. So first we're going to lie our patient supine in a firm surface, and then first we're going to do inferior glide of the GH joint using grade 1 mobilization. So this is all going to be just oscillation. So this is grade 1. And then observe your patient's reaction, and then assess the joint after. And then we're going to do the posterior glide of the GH joint to increase shoulder flexion. So we're going to do grade 3 mobilization. So it's going to be large amplitude mobilization of the shoulder. Okay, next we're going to do a superior glide of the GH joint to increase adduction. So I'm going to assess the joint first and see the restriction. And then I'm going to do a small amplitude mobilization for a grade 4. Okay. For the anterior glide of the GH joint, to increase the extension of the shoulder, I'm going to do a grade 2 mobilization. So the patient have to lie prone and should be comfortable. So with the grade 2, it should be in the mid-range with large amplitude. So I'm going to do. Is that okay? Okay. So you're going to assess the joint and note your patient's reaction, if he's comfortable or not, if he's have any pain or no. Okay. Okay, so now I'm going to demonstrate elbow flexion. So first I'm going to palpate for the radius and the ulna. So once I palpate it, I'm going to glide the ulna over the humeral head. So let me assess the joint first from the initial midpoint and the restriction. Once I feel the restriction, I'm going to do a small amplitude mobilization. Do you feel it? Mm-hmm. Okay. And then I'm going to assess the joint if there is an increase of motion. Okay, so now I'm going to do joint mobilization to increase the forearm pronation. So first I'm going to assess and try to palpate the radial head. And once I do, I'm going to stabilize the humerus, and then I'm going to do a grade 3 mobilization. So it's going to be large amplitude. And then I'm going to assess the joint after. And is it okay? Mm-hmm. Do you feel any pain? No. Okay, that's it. All right. Okay, so now I'm going to do to increase the forearm supination. So to increase the range of motion, I'm going to assess the radial head, and I'm going to stabilize the humerus. And then I'm going to do a grade 2, so it's going to be a large amplitude at the mid-range. So after the joint mobilization, I'm going to assess the joint, if there's an increased range, and if there's any pain from my patient. Is there any pain? No pain. Okay. Okay, so now we're going to do a joint mobilization at the wrist joint. So I'm going to stabilize here, and then I'm going to move the hand. So I'm going to move it towards the anterior side to increase the wrist flexion. So let's begin by doing grade 3. So it's going to be large amplitude. Do you feel the movement?
Mm-hmm.
Is it comfortable?
Mm-hmm.
Okay. And then I'm going to assess the joint. Okay, that's it. Okay, so now for the wrist extension, we're going to move the hand on the dorsal side, and then I'm going to stabilize the what do you call this? The forearm, and then I'm going to move the hand towards the dorsal side. So I'm going to do a grade 4, so I'm going to assess the joint from the initial mid-range into the restriction. From restriction, I'm going to do a small amplitude. Okay, and then I'm going to assess the joint. And assess my patient if there's any pain. Is it okay?
No
All right.
pain.
Okay, so now we're going to do radial deviation. So I'm going to stabilize the forearm again. And then I'm going to move the hand towards the ulnar side to increase the radial deviation. So I'm going to do a grade 3 to increase the range of motion. So it's going to be a large amplitude. Okay, and now I'm going to assess the joint for the increase of motion. Do you feel comfortable?
Mm-hmm.
Okay. Alright, so that's for the radial deviation.
Let's go.
I'm Benalie Trino, and that concludes my presentation for the joint mobilization of the shoulder, elbow, and wrist joint.